Okay, so we're going to do NG tube application. One of the first things I do is test patency of nares. So obviously this is a model, it's kind of difficult, but just make sure that you're testing patency of nares. Another thing I do is check length of the NG tube. So I'm just going to pour it onto my thing. And I'm going to get some jelly ready. So you can have little packs of lube or like a large one and just put like a thing. All right, so for this, I usually roll the top so that it curves and makes it nice and easy to go into the patient and kind of try and hold it into that position for a minute. The other thing I do is measure from back of ear to like base of sternum essentially to see how essentially long this is. It's very difficult to do that in a model, but there are markers on here so you kind of know how far to go into the patient. So do all that and lube up the patient. For the patient, make sure the patient has a cup of water and a straw. You're going to go ahead and ask them to drink as you're inserting to help them swallow. And I also have them put chin to chest to help it go down so you're not going into the trachea. So, all right, so we're gonna get started. So they have their water. I have my NG tube. I'm holding their head. I tell them to put chin to chest. And I stick the tube in and I say swallow, swallow, swallow. And I keep reminding them to swallow until I get to the point that I had pre-measured. Once I'm in the designated spot, and you can actually see on the model that I'm in the correct location, obviously in a person you can't, you're going to go ahead and I can use a syringe to make sure I'm also in the appropriate spot connected to the white portion. This is typically for meds. Aspirate to make sure I get contents. Remove that. This can also be connected to suction. And then lastly, I'm going to go ahead and tape this to the nose and then send the patient off to x-ray to make sure, again, it is in the proper placement. But I go under the tube and then like wrap around the nose like that. And that's it.